All of this comes at a time we had a child dying in Florida, a child who never took the flu vaccine. Some people are saying had that child taken the flu vaccine, this wouldn't have been the concern that it was, and her situation would have escalated the way it did. Hard to say. This much is not. A lot of people are re-examining the whole vaccine thing. Right with us right now is Dr. Janette Nesheiwat. We don't know much about this girl, but do you, doctor, and what happened here?
You know, my heart goes out to her family, Neil, but it's so unpredictable on how the flu can affect different people differently. Now, one thing that we do know is that she was unvaccinated, and this is exactly why the CDC recommends that everyone get their flu shot. Try to get it no later than October of each year. It is a yearly vaccine. Last year, 80,000 people died from the flu, Neil, and 80% of them were not vaccinated. So ages 6 months of age and older, it is recommended to get your flu shot. Definitely is the #1 way to prevent getting the flu.
Did you find any correlation between those who didn't get vaccinated and those that had problems otherwise? Because there are people who are afraid to get vaccinations for fear it's a bad batch, or that it doesn't do the trick, or they get the flu anyway.
So most people that got vaccinated either did not get the flu, or even if they did catch the flu, their symptoms were less severe. In some people, you can develop, for example, respiratory distress, pneumonia, difficulty breathing. So even if you got the flu shot and it was not as effective, for example, as it wasn't last year, it could still help minimize the symptoms, which is very important, because it can be, there can be some people who are at high risk. For example, if you have asthma, or diabetes, or heart disease, or if you're pregnant, you're at a high risk. Also, those people who are below age 5 or over age 65, again, high risk. But definitely the numbers that we see with the complication and the deaths are with those who have not been vaccinated.
They always worry about different strands of this. There was a virulent strand last year, I think 2 years prior to that. Anything like that this year?
So there's what's called the shift and drift, and the reason why we have different strains each year is because the genes and the viruses change, they mutate. So the CDC is working very hard every year to try to predict. We can't predict, but to try through their research to develop vaccines targeted against these viruses. Usually it's strands of influenza A and influenza B. They're targeting this year, the vaccine is targeting some strands of influenza A and influenza B. And I can tell you this, compared to last year this time, I'm not seeing as many cases as I did last year this time. But it's unpredictable how each year will result as far as who gets the flu, how many deaths. But hopefully this year will not be as bad as last year. But the #1 way to prevent the flu, get your flu shot, in addition to, of course, keeping your hands washed and clean, staying warm, staying hydrated, and staying home if you're sick, because you can make other people sick and you can get worse.
Yeah, all good points. Dr. Janette Nesheiwat, thank you very, very much. Good seeing you.
It's my pleasure. Good to see you, too.